If you're preparing for prostate surgery, it's important to know that certain foods may negatively affect your surgical outcomes. Surgeons are warning about 5 specific food groups that should be avoided during the preoperative period. These foods may increase bleeding risk, alter anesthesia metabolism, or slow postoperative healing. Being aware of these foods and eliminating them from your diet can improve the success of your operation. Research shows that approximately 30% of men over 60 will require some form of prostate surgery during their lifetime, whether for benign enlargement, cancer, or other conditions. This makes prostate procedures among the most common surgeries performed on older men in the United States. Yet what many patients don't realize is that dietary choices in the weeks and days leading up to surgery can significantly impact surgical outcomes. What's particularly concerning is that some foods commonly considered healthy may actually increase risks during the perioperative period. Let us know where you're watching from and how old you are in the comments below. The issue of pre-surgical nutrition has gained increasing attention from urologists and anesthesiologists who specialize in prostate procedures. What's consistent across these specialists' observations is that being mindful of your diet before surgery may help reduce complications and support optimal recovery. When surgical teams first began investigating the connection between diet and surgical outcomes, many were surprised to discover that certain everyday foods could significantly affect bleeding risk, anesthesia effectiveness, and healing capacity. However, as our understanding of food-drug interactions has advanced, the biochemical mechanisms behind these effects have become clearer. I'm Dr. William Chen, and for over 25 years, I've specialized in urological surgery with a focus on prostate procedures. Today I'll share critical information about 5 foods that should be avoided before prostate surgery. Foods that, when eliminated from your pre-surgical diet, might help reduce your risk of complications and support a smoother recovery process. Before we explore these foods, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to surgical preparation and recovery, focused on practical, accessible strategies. If you're preparing for surgery or want to support someone who is, you won't want to miss our upcoming videos. The connection between certain foods and surgical risks is worth examining because it involves how your body responds to surgical trauma, how medications used during surgery are metabolized, and how well your tissues can heal afterward. To understand why these foods matter, let's first look at the key physiological processes that affect surgical outcomes. During prostate surgery, several factors are critical for success. Proper blood clotting to minimize bleeding, optimal metabolism of anesthetics and other medications, appropriate immune function for wound healing, and minimal inflammation. Certain foods can interfere with these processes through their effects on platelet function, liver enzyme activity, inflammatory pathways, and more. With these factors in mind, let's examine the 5 food groups that surgeons recommend avoiding before prostate surgery. The 5 foods to avoid before prostate surgery. The first food group that may negatively affect your surgical outcome is foods with natural blood-thinning properties, particularly those rich in omega-3 fatty acids. While omega-3s are generally beneficial for cardiovascular and overall health, their antiplatelet effects can increase bleeding risk during and after surgery. Fatty fish like salmon, mackerel, and sardines contain high levels of these omega-3 fatty acids, particularly EPA and DHA, which inhibit platelet aggregation, the process that helps blood clot. Fish oil supplements are even more concentrated sources of these compounds, and may have even stronger effects on bleeding risk. Additionally, certain plant foods high in alpha-linolenic acid ALA, another type of omega-3, may have similar effects. These include flax seeds, chia seeds, and walnuts, which are often consumed specifically for their health benefits, but could potentially increase surgical bleeding risk. Most urologists and anesthesiologists recommend discontinuing these foods and supplements at least 7 to 10 days before prostate surgery. This time frame allows for normalization of platelet function, while still enabling you to receive the health benefits of these foods during the earlier stages of your pre-surgical period. The second food group that should be avoided before prostate surgery is herbal supplements and teas with anticoagulant properties. Many patients don't realize that natural doesn't always mean safe for surgery. In fact, several herbs commonly used for health purposes can significantly increase bleeding risk. Ginger, garlic, ginkgo biloba, and ginseng are among the most concerning, as they can inhibit platelet aggregation through various mechanisms. Even in culinary amounts, concentrated forms of these herbs, like supplements or strong teas, may affect clotting function. Turmeric/curcumin supplements are particularly noteworthy, as they've gained popularity for prostate health specifically. While they may offer benefits for prostate inflammation in non-surgical contexts, their potent antiplatelet and anti-inflammatory effects make them potentially problematic before surgery. Green tea, especially in extract form or when consumed in large quantities, contains catechins that may affect platelet function and interact with certain anesthetics. Even common herbs like cinnamon, when consumed in supplement form rather than as a food flavoring, may affect blood glucose regulation and potentially interact with medications used during surgery. Surgeons typically recommend discontinuing all herbal supplements at least 2 to 3 weeks before prostate surgery, as some compounds can remain active in your body for extended periods. If you're taking any herbs for prostate health specifically, discuss appropriate discontinuation timing with your surgical team. The third food category to avoid before prostate surgery is alcohol in any form. While occasional moderate alcohol consumption may be part of many men's lifestyles, alcohol can significantly impact surgical outcomes through multiple mechanisms. Alcohol affects blood clotting by reducing platelet aggregation and production, potentially increasing bleeding risk during surgery. It also induces certain liver enzymes involved in metabolizing anesthetics and pain medications, which may lead to unpredictable responses to these crucial surgical drugs. Furthermore, even moderate alcohol consumption can suppress immune function, potentially compromising wound healing and increasing infection risk. Chronic alcohol use may lead to nutritional deficiencies that further impair healing and recovery. The effects of alcohol on surgical outcomes depend on both the amount consumed and the timeline. While occasional light drinking may have minimal impact if stopped well before surgery, regular or heavy consumption presents more significant risks. Most surgical teams recommend complete abstinence from alcohol for at least 1 week before prostate surgery, with longer periods advised for those with more substantial alcohol intake histories. Robert, a 72-year-old preparing for a prostatectomy, was surprised when his surgeon asked about his omega-3 supplements and evening wine habit. "I was taking fish oil and eating salmon twice weekly specifically for my health, and had a glass of red wine most evenings for my heart," he explains. "I had no idea these might affect my surgery. When my surgeon explained the rationale, I immediately adjusted my diet for the weeks before my procedure." After following his surgeon's dietary recommendations, Robert had a successful operation with minimal bleeding and a smooth recovery. "My surgeon mentioned that my surgical field was notably dry, which apparently helped him perform a more precise procedure. I believe the dietary changes contributed to my positive outcome and relatively quick recovery." What surprised Robert most was learning that foods and supplements he considered healthy could be problematic in the surgical context. "This experience taught me that healthy is context-dependent. What's beneficial in everyday life might not be ideal when preparing for surgery. Now I'm much more aware of how my diet might interact with medical procedures." The fourth food group that should be avoided before prostate surgery is grapefruit and certain other citrus fruits, particularly in juice form. This recommendation might seem oddly specific, but it's based on well-established interactions between compounds in these fruits and many medications used during the perioperative period. Grapefruit, pomelos, Seville oranges, often used in marmalade, and to a lesser extent, other citrus fruits contain compounds called furanocoumarins that inhibit an intestinal enzyme called CYP3A4. This enzyme is responsible for metabolizing approximately 50% of all prescription medications, including many anesthetics, pain medications, and cardiovascular drugs commonly used during surgery. When this enzyme is inhibited, medications metabolized through this pathway remain in the bloodstream longer than expected and at higher concentrations. This can lead to increased side effects, excessive sedation, or other unpredictable responses, particularly problematic during a carefully orchestrated procedure like prostate surgery. What's particularly important to understand about this interaction is its duration. The effects of grapefruit on drug metabolism can last 24 hours or longer after consumption, and in some cases, regular grapefruit consumption can affect drug metabolism for up to 3 to 7 days. This means avoiding grapefruit and similar citrus products for at least a week before surgery is typically recommended. This doesn't mean all citrus fruits must be avoided. Regular sweet oranges, tangerines, and lemons generally don't contain significant amounts of the problematic compounds. However, when in doubt, it's safest to check with your surgical team about specific fruits in your diet. The fifth food category to avoid before prostate surgery is foods that may increase inflammation or impair healing through glycemic effects, specifically, highly processed carbohydrates and sugars. While these foods don't present the same acute risks as blood thinners or grapefruit, they can affect your body's healing capacity in the crucial days before and after surgery. Foods with a high glycemic index cause rapid spikes in blood sugar, which can trigger increased inflammation throughout the body. Surgical procedures inherently create inflammation, and additional dietary inflammatory triggers may potentially complicate recovery. Additionally, poor glycemic control can impair wound healing through multiple mechanisms, including reduced collagen formation and compromised immune function. This is particularly important for diabetic patients, but even non-diabetics experience better surgical outcomes with stable blood sugar levels. Highly processed foods often contain not only rapidly absorbed carbohydrates, but also industrial seed oils high in omega-6 fatty acids, which can further promote inflammatory pathways when consumed in excess. The combination of high sugar and poor quality fats creates a particularly unfavorable metabolic environment for surgical recovery. While complete elimination of carbohydrates isn't necessary or advisable, focusing on whole, unprocessed foods and complex carbohydrates in the weeks before surgery can help create an optimal metabolic environment for recovery. Most surgical teams recommend reducing intake of sugary foods, white flour products, and highly processed snacks starting 2 to 3 weeks before surgery and continuing through the recovery period. Thomas, a 68-year-old scheduled for robotic prostate surgery, made comprehensive dietary changes based on his surgeon's advice. I had been drinking grapefruit juice every morning and taking various supplements for prostate health, including fish oil and saw palmetto, he shares. I also regularly consumed wine with dinner. When my surgical team gave me specific dietary guidelines, I followed them diligently for 3 weeks before my procedure. Thomas's surgery went smoothly with minimal bleeding and no complications related to anesthesia. My anesthesiologist commented that I responded very predictably to the medications, which apparently isn't always the case. My surgeon also noted that the surgical field was clear with good visibility, which is crucial for the precision required in robotic procedures. What Thomas found particularly valuable was how the pre-surgical dietary changes improved his overall well-being. Beyond just preparing for surgery, following these guidelines made me more conscious of how various foods affect my body. I've actually maintained some of these changes after recovery, because I feel better overall. Let us know where you're watching from, and how old you are in the comments below. While avoiding these 5 food groups provides a good foundation for surgical preparation, there are additional nutritional considerations that might help optimize your prostate surgery outcomes. These targeted modifications might be worth discussing with your surgical team. Additional nutritional considerations for surgical success. For optimizing wound healing and recovery, ensuring adequate protein intake in the weeks before surgery can be beneficial. Protein provides the essential building blocks for tissue repair after surgical trauma. Some surgical teams recommend slightly increasing protein consumption from high-quality sources like lean meats, eggs, dairy, or plant-based options in the pre-surgical period. For reducing inflammation, incorporating moderate amounts of anti-inflammatory foods that don't increase bleeding risk might be helpful. Berries, cherries, and colorful vegetables contain antioxidants that can help manage inflammation without the antiplatelet effects of omega-3s. These foods provide beneficial compounds while avoiding the surgical risks associated with more potent anti-inflammatories. For supporting immune function, ensuring adequate micronutrient intake through a varied diet rich in fruits and vegetables can help prepare your body for the stress of surgery. Particular attention to zinc, vitamin C, and vitamin D status may be beneficial, as these nutrients play crucial roles in wound healing and immune response. For optimizing gut health before surgery, maintaining a diet rich in fiber and fermented foods until 24 to 48 hours before your procedure, when dietary restrictions for anesthesia typically begin, may help support your microbiome. Emerging research suggests that gut health influences systemic inflammation and immune function, potentially affecting surgical recovery. James, a 74-year-old who underwent prostate surgery, found that a comprehensive nutritional approach was particularly helpful. Beyond just avoiding the problematic foods, I worked with a registered dietitian who specializes in pre-surgical nutrition, he explains. We developed a plan that not only eliminated the risky foods, but also focused on nutrient-dense options that would support healing and recovery. After implementing this comprehensive approach, James experienced a notably smooth recovery. My surgeon mentioned that my tissues handled the surgical trauma exceptionally well, with minimal swelling and rapid healing. I was able to return to most normal activities faster than expected, which I attribute partly to my nutritional preparation. What James appreciated most was feeling actively engaged in his surgical preparation. Rather than passively awaiting surgery, taking control of my nutrition gave me a sense of participation in my own care. This psychological benefit was significant. Feeling like I was doing everything possible to ensure a good outcome reduced my anxiety considerably. The science behind food surgery interactions. The recommendations to avoid certain foods before prostate surgery are supported by both clinical research and extensive surgical experience. Understanding the scientific basis for these guidelines can help motivate compliance with what might otherwise seem like arbitrary restrictions. The effects of omega-3 fatty acids on platelet function have been well documented in numerous studies. Research published in the Journal of the American College of Cardiology demonstrated that fish oil supplementation prolonged bleeding time and reduced platelet aggregation in a dose-dependent manner. Similar effects have been observed with high dietary intake of fatty fish and plant-based omega-3 sources. The interactions between herbal supplements and surgical medications have been the subject of increasing research attention. A comprehensive review in the Journal of the American Medical Association identified numerous herbs that can increase bleeding risk, interact with anesthetics, or otherwise compromise surgical safety. Many of these interactions have been confirmed through both laboratory studies and clinical observations. The impact of alcohol on surgical outcomes has been extensively studied, with consistent findings across multiple surgical specialties. Research in the journal Anesthesiology demonstrated that alcohol consumption affects both pharmacokinetics, how drugs are metabolized, and pharmacodynamics, how drugs affect the body, of anesthetics, potentially leading to unpredictable responses during surgery. The grapefruit drug interaction is among the most well-established in clinical pharmacology. First identified in the 1990s, this interaction has now been documented with over 85 medications, including many used in the perioperative period. The mechanism involving CYP3A4 enzyme inhibition has been thoroughly characterized through both in vitro and clinical studies. The relationship between glycemic control and surgical outcomes has been demonstrated across numerous surgical specialties. Research published in the Annals of Surgery showed that even modest elevations in blood glucose were associated with increased surgical site infections and compromised healing, effects that were observed even in non-diabetic patients. Now, I want to share what might be the most important factor for success with these dietary modifications, something that surgeons consistently emphasize. The key factor appears to be timing and communication. Different foods affect surgical risk through different mechanisms and timelines, so understanding when to eliminate each food type is crucial. While some general guidelines exist, the optimal approach involves discussing your specific dietary habits, supplement use, and health conditions with your surgical team to develop personalized recommendations. It's also essential to be completely honest about your diet and supplement use when speaking with your surgical team. Some patients feel embarrassed about certain dietary habits or worry about judgment regarding supplement use, but withholding this information can compromise surgical safety. Your surgical team needs this information to provide optimal care, not to judge your choices. Michael, a 79-year-old who underwent prostate surgery, emphasized the importance of this transparent communication. I was initially hesitant to mention some of my supplements because they weren't prescribed by a doctor, he shares. But when I finally disclosed everything I was taking, my surgeon identified several items that could have caused problems during surgery. Making these adjustments potentially prevented complications I wasn't even aware of. What Michael found most valuable was the personalized guidance this honesty enabled. Instead of generic advice, my surgical team gave me specific recommendations based on my unique situation. Which supplements to stop immediately, which could be continued until closer to surgery, and which foods might interact with my particular health conditions and medications. For those preparing for prostate surgery, I recommend having a detailed conversation with your surgical team about your diet, supplements, and alcohol consumption at least 1 month before your scheduled procedure. This timing allows for appropriate adjustments to your regimen, with enough lead time to address any concerns specific to your situation. Remember that these dietary considerations should be part of a comprehensive approach to surgical preparation that includes medication management, physical preparation, and psychological readiness. While nutrition is important, it's just one component of the complex process of preparing for a successful surgical outcome. It's worth noting that while these recommendations are generally applicable to most prostate procedures, the specific guidance may vary based on your surgical approach, open, laparoscopic, or robotic, your overall health status, and the particular medications you'll receive. This underscores the importance of personalized advice from your surgical team. Let's summarize the 5 food groups that should be avoided before prostate surgery. Foods with natural blood-thinning properties, particularly those rich in omega-3 fatty acids like fatty fish, fish oil supplements, flax seeds, and walnuts, should be discontinued 7 to 10 days before surgery to reduce bleeding risk. Herbal supplements and teas with anticoagulant properties, including ginger, garlic, ginkgo biloba, ginseng, and turmeric/curcumin supplements, should be stopped 2 to 3 weeks before surgery to prevent increased bleeding and potential anesthetic interactions. Alcohol in any form should be avoided for at least 1 week before surgery to prevent altered medication metabolism, increased bleeding risk, and compromised immune function. Grapefruit and certain other citrus fruits, particularly in juice form, should be eliminated at least 1 week before surgery to prevent interference with the metabolism of anesthetics and other medications. Foods that increase inflammation or impair healing through glycemic effects, specifically highly processed carbohydrates and sugars, should be reduced 2 to 3 weeks before surgery to create an optimal metabolic environment for recovery. Additionally, consider optimizing protein intake, incorporating safe anti-inflammatory foods, ensuring adequate micronutrient status, and supporting gut health as part of your comprehensive pre-surgical nutrition plan. By understanding and implementing these dietary adjustments before your prostate surgery, you may help reduce your risk of complications, support optimal surgical conditions, and potentially enhance your recovery process. While no dietary approach can guarantee a complication-free surgery, these evidence-based adjustments represent prudent steps that may contribute to better outcomes. If you found this information valuable, please consider sharing this video with friends and family who might be preparing for surgery. Many patients are unaware of how their diet might affect surgical outcomes, and this knowledge could potentially help others avoid unnecessary risks. Subscribe to our channel for more evidence-based approaches to surgical preparation and recovery, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of health optimization for older adults, always focused on practical, accessible strategies. Thank you for joining me today. I wish you a successful surgery and smooth recovery in the days ahead. Until next time, take good care of yourself.